Hello and welcome to the MMAP Update Training on MyHealthLink, Michigan's Integrated Care Project. Today we'll be discussing MyHealthLink, what it is. We're going to discuss the eligibility criteria for MyHealthLink, the benefits, covered services, enrollee protections, what to consider when choosing a MyHealthLink plan, and enrollment and beyond. So MyHealthLink is a relatively new program that joins Medicare and Medicaid benefits, rules, and payments into one coordinated delivery system called MyHealthLink. It's a pilot project that's operating in 4 different regions. And it started about a year ago, and it will be going for an additional 2 more years. MyHealthLink is really kind of like a special needs Medicare Advantage plan for duals, an SMP. So it really much, it has the Medicare component, the Medicaid component, and the prescription drug component, just like the Medicare Advantage special needs plan. The difference between the special needs plans and the MyHealthLink plans is that MyHealthLink also covers long-term care support and behavioral health support. So it has all the functionality of a special needs plan, but with the additional features of having long-term care and behavioral health integrated into this one plan. So MyHealthLink began March 1st of 2015, and it's a 3-way contract between Centers for Medicare and Medicaid Services. That's the federal agency that is in charge of the Medicare program, and then has some oversight of the state Medicaid program. The Michigan Department of Community Health, which has now been rebranded into the Michigan Department of Health and Human Services, and then the MyHealthLink plan itself. So the MyHealthLink plan is not just in a contract with the state of Michigan, but also CMS as well. Now, all the MyHealthLink plans are required to have contracts with prepaid inpatient health plan, PIHP, to deliver behavioral health services. And really what that means is that all the community mental health centers in each county, they contract with the MyHealthLink plan to administer behavioral health services. Now the 4 regions that are impacted are Region 1, 4, 7, and 9, and that's the entire Upper Peninsula for Region 1. Region 4 is Southwest Michigan. Region 7 is our neighbors to the south, Wayne County, and then Region 9 is Macomb County. Now, in Macomb County, there are 5 MyHealthLink plan options for somebody to enroll in. Each region has different health plan options. So just because these are the 5 for Macomb County, it doesn't necessarily mean that these plans operate in the other counties as well. For example, Region 1, which is the UP, they only have 1 MyHealthLink plan available, and it's not any of these on the list. So for Macomb County, the MyHealthLink plan options are Aetna Better Health, AmeriHealth, Fidelis Secure Care, Pat Midwest, and Molina. And you know, because we're only talking about Macomb County, if you do get a caller from Wayne County, it's really best to direct them to the area agency on aging that serves them. Now in Macomb County, the prepaid inpatient health plans that each of these MyHealthLink plans must contract with, and again, this is for behavioral health services, is the Macomb PIHP, which used to be referred to as the Macomb Department of Community Health. This is the latest My HealthLink enrollment dashboard, which was completed in March 2016. And it gives you an idea of the current enrollment for My HealthLink. Now, depending on the day, you're going to get a different number on the total number of dual eligibles in Macomb County. The total number of dual eligibles in Macomb County is somewhere between 12,000 and 16,000, again, just depending on when they take those, the census numbers. And so you can see over here in this enrollment by region, in Macomb County, of those roughly 12,000 dual eligible beneficiaries, only 3,800 are enrolled in My HealthLink. So we really do have a low enrollment for My HealthLink. Of those people who are enrolled in My HealthLink, 94% of those reside in the community, with only 6% living in nursing homes. So that could explain the low number, that not very many nursing home beneficiaries are enrolling in My HealthLink. And just some background on this, that, you know, when My HealthLink was first rolled out last year, the contracts weren't, between the My HealthLink plans and the nursing homes, weren't yet complete. So a lot of the nursing home administrators were telling beneficiaries just to stay with original Medicare and Medicaid and opt out of My HealthLink. So that could explain some of the low enrollment. Obviously, there's a lot of other factors, like people not wanting to change, people not understanding what it might be, just a lot of other reasons for that. Also interesting, they have this breakdown, total enrollment by age group, and then this corresponding pie chart. 56% of those people enrolled in My HealthLink are actually under the age of 65, which is pretty staggering. And then just to give you an idea of the total enrollment by region, Wayne County, by and large, has the greatest enrollment numbers. 54% of all My HealthLink enrollees are Wayne County residents, with Macomb County only comprising 12% of that. So there is some, education to do for Macomb County. While it's not our job to promote and one plan over the other, we can take strides to help educate people so that they're making the best decision for themselves. So the next thing we'll discuss is eligibility criteria. In order to be eligible for My HealthLink, a person has to live in one of the 4 regions. They have to be age 21 or over. And anybody who's currently enrolled in the Children's Special Health Care Services are excluded from My HealthLink. Now, what the Children's Special Health Care Services is it's for those children who were disabled, kind of severely so. And there's some extra support that's provided to those disabled children. Now, Children's Special Health Care Services is a Medicaid program. But it's very, very special. And even though, it is for children who are disabled, some children kind of may get this when they are younger, but then keep these services, a little bit beyond the age of 21. So if they are currently on Children's Special Health Care Services, they are not eligible for My HealthLink. Also, in order to be eligible for My HealthLink, a person has to have full benefits under both Medicare and Medicaid. So they have to have both Medicare Parts A and B, and they have to be eligible for full Medicaid services. So those people who have a Medicaid spend down are not eligible for My HealthLink. Those people who have only have Medicare savings programs are not eligible for MyHealthLink. They have to be eligible for full Medicaid benefits. And then finally, in order to be eligible for MyHealthLink, a person cannot be enrolled in hospice. And the reason for this is that Medicare does hospice billing very specially, and they don't want anybody in a Medicare Advantage plan in hospice because of how they bill the hospice providers. So the hospice eligibility criteria is not specific just to MyHealthLink. Really, it's part of a larger Medicare Advantage rule. So that's the eligibility criteria. Also, there's some special considerations for certain populations. People who are enrolled in PACE and MyChoice are eligible, but they must leave their programs before joining MyHealthLink. So as a refresher, PACE is Programs for All-Inclusive Care for the Elderly, and that's for people who have both Medicare and Medicaid, who are aged 55 years or older, who live in a PACE geographic region, and they will go to the PACE service, the PACE provider for all of their health insurance and health care needs. So PACE becomes their primary care provider. PACE becomes their insurer. So it's a different relationship, but the PACE program acts as the insurer, it acts as the primary care provider, and it helps coordinate all those services that somebody who's nursing home eligible might need in order to stay in the community. MyChoice, one thing about PACE is that there are parts of Macomb County that are in a PACE area. The Centers for Senior Independence is a PACE that operates out of Detroit, and the southernmost tip of Macomb County is in that PACE geographic region. So we're talking about parts of Warren, Fraser, Roseville, Centerline, St. Clair Shores, and the southernmost tip of Clinton Township. Those are all within that PACE geographic region. So it is possible that you may have a beneficiary that is in PACE and is affected by this. MyChoice is another program for long-term care, and it is operated by MyChoice waiver agents in Macomb County, that the Area Agency on Aging 1B and the Macomb Oakland Regional Center. We both offer MyChoice. And what MyChoice does is it provides, has a care manager that coordinates services for somebody so that they can stay at home. So it provides them some long-term support. And that might be personal care or adult daycare or respite or transportation, anything that might help somebody stay independent. PACE and MyChoice are very similar programs, but they operate a little bit differently. So, I like to say that PACE is very good for somebody who needs more clinical support, and MyChoice is good for somebody who needs more social support. But obviously, as I say that, there are people who are going to fit both categories just fine. Anyhow, because of how PACE and MyChoice operate, right, PACE and MyChoice each authorize a certain level of services, certain types of services. They have their own care plans. But somebody can still get MyHealthLink, and within MyHealthLink, these MyHealthLink plans have to offer those long-term care supports and services like PACE and MyChoice. So if somebody wants to, if they're in MyChoice or PACE, they can go and they can leave those programs and join MyHealthLink. But the thing is that the same level of services might not be provided, the same services themselves might not be provided. So they are taking a risk. if they leave their current My Choice or PACE program in favor of My Health Link. So there's some things for them to think about. Also, people with a spend down are not eligible for My Health Link. And finally, people in nursing homes are eligible for My Health Link, but My Health Link does not impact their patient pay amounts to the nursing home. So when somebody's approved for nursing home Medicaid, they are given a patient pay amount that they have to send to the nursing home. So most people, they have their Social Security check, and the nursing home takes their Social Security check in order to help. That's their patient pay amount. Anyhow, if somebody's in a My Health Link program, they still have to pay their patient pay amount. It's just My Health Link becomes their insurer. So what are the benefits of joining a My Health Link plan? Well, there are certain benefits. The first is that there's no co-payments or deductibles for My Health Link, and this includes prescription drugs. Now, as kind of a refresher, right? If somebody has original Medicare and straight Medicaid and they're in a prescription drug plan, they have full LIS, right? So they only have a copay of $1 and change and $3 and change. But, like many of you, we've worked with the dual eligible population, and we've done those drug lists for some people that have 20 or 30 medications. And so even though somebody, has this full LIS because they're dual eligible, sometimes even those low copays are cost prohibitive, right? Especially when you have so many medications and have such a low income. So one really great benefit of My Health Link is there's no co-payments for their prescriptions. So if you are talking to somebody and they have a lot of prescriptions and they say they cannot afford them, this might be a very great solution for them. Also, it's only one health plan, one card. And so when somebody goes to the doctor's office with My Health Link, they just show them the My Health Link card. They don't have to show them their Medicare card and then their Medicaid card and then a prescription drug plan card. And, it's just one card. And for some people, this is a great benefit because it gets so confusing. The other benefit of My Health Link is that it's person-centered care for both healthcare services and the long-term care supports and services and behavioral health services. And what this means is it's the member, it's the beneficiary that's driving the health care. It's not necessarily the health insurance. My Health Link plans are required to be person-centered, and that means that the person's in the driver's seat with their health care. One way that they do that is every member will have a plan of care, and that plan of care is actually directed by the patient. The health plans ask them, what are your goals? And so you may have somebody that, is walking with a walker and has multiple sclerosis and, may have diabetes and, some neuropathy and some heart problems, and instead of trying to have the doctor or the health plan assume what the goals are, maybe that person's goal is just to walk without a walker. Maybe, maybe that's their goal. Maybe they don't care about controlling, their sugar right now. Maybe they think that's fine. Maybe everything else is fine and manageable, but man, they really would like to just get rid of that walker. Well, that would be that person-centered plan of care. It's not the doctor or anybody else or the health plan deciding what the beneficiary should do. It's the beneficiary saying, this is what I want to do. And the health insurance company and providers meeting them where they're at. There's also a 24/7 nurse advice line, which is pretty useful. Especially, you think about it, I know that anytime I get sick, it's never 9 to 5, Monday through Friday. A lot of people, feel very, very ill on the off hours, maybe at night or during the weekend, and they can't get a hold of their doctor. Well, this 24/7 nurse advice line is a really great resource when somebody's wondering, should I go to the emergency room right now, or should I wait it out? Is there something I can do? They can call that nurse advice line 24/7 and really have some feedback. For some people it's providing reassurance and, maybe looking at the medications that they're on, maybe with an interaction, maybe there's something that somebody could take over the counter. But it helps, really provide that person reassurance if needed, or, the confirmation that they need to go to the emergency room. Another benefit of the My HealthLink plan is a care coordinator. Every member will have a care coordinator. And so this person does a few really great things. The first thing is that care coordinator helps implement that plan of care that people are on. So, in the example of that person who wanted to walk without a walker, that care coordinator helps that member get the services or coordinate those services if they need it, right? So, maybe that it's, this is an HMO, so there would be a referral that would be needed to go to any specialist, but maybe it's, helping them find the specialist if they don't have one, or maybe it's, helping them think about what questions to ask the doctor. It could be something like that. But also the care coordinator can also cue into other supports and services that somebody might need. So if somebody's health declines, maybe it's time for them to be assessed for a long-term care services. Or if, it looks like the person's nutrition is not doing well, then maybe it's time to make a referral to the Meals on Wheels program. They can do some of those social types of things that can help support a member or a Medicare beneficiary. And through those supports, then, that would help their overall health. And then finally, another benefit of the My HealthLink team is there's an integrated care team. And that integrated care team is comprised of the health plan, any of the providers that the patient sees, the My HealthLink member, and if the My HealthLink member wants their family present, that's great too. But it's all a team, and it's a functional team. So, the integrated care team is required to meet periodically to review the cases. And each plan will work that very, very different. I recently was talking with somebody who worked at a health plan, and the way that they did this was that they orchestrated these integrated care team meetings with the doctors. And so it may just start out as a chart review based on primary care physician, and they would review all those cases. Now, there's going to be some members that don't go to the doctor, or there's going to be some members that are really frail, and so you're going to probably have some members that receive more attention than the others, but still, they have this team that they are required to review all the members' care. So we talked about the certain benefits of the My HealthLink. Now let's talk about covered services. So in a nutshell, the covered services for My HealthLink are all the Medicare covered services, all the Medicaid covered health services, prescription drug coverage, all the Medicaid covered long-term care services, and all the Medicaid covered behavioral health services, right? So it's all of these. Some more details. We're talking about the covered medical services. That includes medication, dental and vision, equipment and supplies, hospitals, surgeries, diagnostic testing and labs, nursing home services. And when they're talking about this, nursing home is a medical covered thing. Really, they're talking about skilled nursing facility or rehab. Home health care, and then transportation. Now, the transportation includes emergency transportation by ambulance, but it also includes medical non-emergency services, and that would be transportation to and from their doctor's appointments. So the covered long-term care supports and services of MyHealthLink includes personal care, equipment to help with the activities of daily living, chore, home modifications, adult daycare programs, private duty nursing, preventative nursing, respite, home-delivered meals, community transition. And what that is if somebody is in a nursing home and they want to transition and live in their own home, there's a Medicaid program right now called Nursing Facility Transition that helps do that. And so, you know, this would put kind of in all the home modifications or supports that are in place so that somebody can live safely at home. So this community transition program is also available through MyHealthLink. Also, there's a fiscal intermediary services for the community-based long-term care program. So, for example, My Choice has this. And what that is sometimes a person can be in My Choice and they want to direct their own care. That they appreciate their care manager, but the person wants to choose which company comes, and the person wants to pay them. So what that fiscal intermediary is that fiscal intermediary works with that member. And it's okay, here's your budget and here are the services that you've been authorized for. So maybe they were authorized you know, X amount of dollars for personal care. So given that confine, the person can choose whoever they want to pay, you know, so as long as they meet certain requirements, the hours per week, as long as it remains in that budget, the person can self-direct that care. So this fiscal intermediary service is also available through the MyHealthLink program. Another long-term care support and service that's available is PERS. That's the Personal Emergency Response button. That's that button, the I fall and I can't get up button. And then nursing home care is another long-term care supports and services that's covered by MyHealthLink. And then finally, we have behavioral health services. And just to kind of be clear, behavioral health services are those that are provided to individuals who have mental illness, intellectual or developmental disability, or substance abuse disorder. So it covers all three categories of support. And so the services for behavioral health are accessed through the health plan, the PIHP, or local community mental health service provider. So we talked before that somebody in MyHealthLink, they would go through their health plan to get it, and the health plan coordinates with the PIHP, right, also called community mental health. Or if somebody contacts community mental health for services and, you know, they're duly eligible in a MyHealthLink plan, the PIHP can contact the health plan, right? They work together, and the idea is that if PIHP and MyHealthLink plan work together, it's going to be easier for the beneficiary. The beneficiary is not going to have to, you know, jump through all these hoops and be, you know, referred to this person or that person, that wherever they go to ask about behavioral health services, whether it's a plan or PIHP, they're going to work together to make it happen. And, if somebody is currently receiving services through community mental health, everything's going to stay the same. It's not going to change or be interrupted, even though they may be in a My Health Link plan. So some examples of the behavioral health services that would be included, it could include individual, group, or family therapy, medication review, supported employment, community living support such as meal preparation, laundry, chores, or food shopping, substance abuse treatment and services, and this might be assessment, treatment planning, stage-based intervention, referral, and placement. So we talked about the medical services that are covered. We talked about the long-term care services that are covered and the behavioral health services that are covered. Plans can also choose to cover additional services that are not offered by Medicare or Medicaid. They can enhance their plans and offer more. And this might be covering something that's not covered by Medicare or Medicaid, or they can cover supplies or services more often than Medicare or Medicaid would allow. Or they may cover a higher dollar amount when there's a dollar limit on a service, right? So for example, we have the physical therapy cap. They may choose to waive those physical therapy caps. It's up to that plan. But those benefits would be standardized, right? So if you want to know if a plan has enhanced services, it'll be on that Medicare plan finder, just like with any other Medicare Advantage plan. So in a nutshell, covered services under My Health Link, it includes the services that a special needs plan would have, right? That's the Medicare, Medicaid, and the prescription drugs, medical coverage. The two long-term care services, and then community mental health services. So it's all of that rolled up into one. So when we're talking about My Health Link, there are a lot of questions from beneficiaries, and really they're scared of change, and they want to know that if they change to a My Health Link plan, are they going to be okay? And there are quite a few enrollee protections for those My Health Link members. So the enrollee protections that are offered are grievance and appeals. So just like original Medicare and Medicaid, or any other Medicare Advantage plan, people in My Health Link have the right to file grievances and appeals, and they're notified of their rights in any of the plan documents or notification letters. So, when somebody gets their welcome packet, they're going to be given a number to file a grievance. And just so a grievance is when a member disagrees with how they've been treated, they can file a grievance. But appeals are when the member disagrees what's been covered or not covered. So appeals are billing-related things, and grievances are treatment. I don't agree with how I was treated, or I think that I was discriminated against. Those are types of grievances. So one of the enrollee protections is grievances and appeals. The next enrollee protection is there is a My Health Link Ombudsman. This office just opened a couple months ago. It has its very own website, mhlo.org, so that stands for My Health Link Ombudsman. It also has a 1-800 phone number that's listed here as well. The goal of the My Health Link Ombudsman is to help them navigate some of the problems, right? So we've gotten a lot of calls about people who've had a lot of problems, and for a while we were kind of trying to work with the state of Michigan to fix some of these problems. That might be that there was a beneficiary who was cognitively impaired and may have had like a power of attorney, and that power of attorney wasn't allowed to speak on behalf. Maybe it was getting the paperwork to that member so that they can advocate on behalf of somebody, or it could be something where somebody isn't, there was some kind of enrollment problems, or maybe we just have a kind of an array of really weird situations. Well, the My Health Link Ombudsman can help with that. They can help with any problems in accessing their care, any problems that they may have with the plan. So maybe the plan isn't authorizing a particular service that they feel that they need. And they certainly can go to the My Health Link Ombudsman if working with a plan doesn't work. So this is a tremendous resource that's available. Another enrollee protection is the choice of providers. So this not only means that there cannot be one provider, so like in the county. So if I wanted to go see a cardiologist, right, there has to be more than one cardiologist in the service area. That also means that there has to be a reasonable driving distance, So if we look at the landscape of Macomb County, it's a very large county, and so really there has to be a choice of providers within a reasonable distance. Also, there's continuity of care requirements. So what that means is if somebody was getting services before My Health Link and then they were enrolled in My Health Link, that there would have to be some continuity of care as they transition to the plan. And we'll talk about the details of what that looks like in just a sec. Also, each plan has to have an advisory council. And that advisory council is comprised of different providers, different nonprofit stakeholder groups. But then, most importantly, that advisory council is mostly made up of the My Health Link members of that plan. So the idea is that, yeah, there's going to be an advisory council that has some clinicians and stakeholder groups, but really the representation is mostly members so that they can help provide some insight on benefits that impact them and their peers. And then finally, the state of Michigan has an advisory council, so for My Health Link. And that state My Health Link Advisory Council, accepts applications. So if you are interested in serving on the State Advisory Council, if you go to the My Health Link website, there's an application for serving on the State Advisory Council. It certainly doesn't have to be a staff member. You and your role with MMAP is perfect as being a stakeholder. So those are the enrollee protections. Now you talked a little bit about continuity of care, but here's some more details on what that looks like. So the health plan must allow enrollees to continue to see their current doctors and providers during a transition period. And they have to pay the out-of-network doctors and providers during the transition period at no cost to the enrollee. They have to allow choice of personal care services, including paying the family member or friends to provide the service. So for like the home health grant, that home health grant is if somebody has full Medicaid and they need a little extra support because of their functionality and their activities of daily decline of the activities of daily living. That home health grant is a monthly stipend that allows a Medicaid beneficiary to get personal care services, and they can do that through an agency, or they can do that by paying family members. And so My Health Link will also allow choice of personal care providers, including family members. Also, the health plan must work to bring providers into the plan's network so that the plan's network is always growing and becoming more robust. And then they have to cover the current medication. Very important, though, that the health plan must honor current authorizations for services. This can either be reported to the plan by the enrollee or through information provided by the State of Michigan, Michigan Department of Health and Human Services. For those who want to join a MyHealthLink plan and are already in a nursing home, they are not required to move to a different nursing home in the plan's network. The health plan must enter into a single case agreement for those enrollees residing in out-of-network nursing homes. Likewise, enrollees have the right to live in an out-of-network nursing home for the life of the program if the enrollee resides in the nursing home at the time of enrollment, has a family member or spouse that resides in the nursing home, or requires nursing home care and resides in a retirement community that includes a nursing home. So what do we like? What does the continuity of care transition period look like? Well, it depends on the service. So for scheduled surgeries, the plan has to honor specified provider and provider authorizations for surgery scheduled within 180 calendar days. For dialysis, the health plan must maintain current level of service and same provider at the time of enrollment for 180 calendar days. Chemotherapy and radiation, they just have to finish their current course of treatment with a specified provider. Any transplants, they have to honor the specified provider and prior authorizations for those as well. Durable medical equipment, the plan has to honor prior authorizations when the item has not yet been delivered, and must review ongoing prior authorizations for medical necessity. So this might be for like oxygen. That would be an example of an ongoing prior authorization. Dental and vision, again, the health plan must honor prior authorizations when the service has not been delivered. For home health care or personal care or physicians and practitioners, for people receiving services from the PIHP, specialty services and supports program, or the HAB supports waiver, the plan must maintain current provider and level of services at the time of enrollment for 180 calendar days. For all other enrollees, it's 90 calendar days. The My Choice waiver, they have to maintain the providers and level of services for 90 calendar days. So that's that transition period, and it's just really good to kind of have that that information as a reference, you know, on your desk. Or so what should people consider when joining MyHealthLink? Well, the first thing we want to look at is, do their current doctors and providers participate in the health plan? And if they don't, is that a deal breaker? Are current medications covered by the MyHealthLink plan? So even though there's no copay for prescriptions, still, just like any other Medicare Advantage plan, each MyHealthLink plan has its own formulary. And then those participants of PACE or My Choice that leave their current My Choice or PACE program to join a MyHealthLink plan, well, you know, we talked a little bit, right? There's no guarantee that the same services are going to be approved or the same level of services are going to be approved by the MyHealthLink plan. So it could be very possible that they switch to join a MyHealthLink plan and they don't like it. And if that's the case, though, they're not guaranteed their initial slot with their My Choice or PACE provider. If they return to PACE or My Choice, they would have to go get on the bottom of the waiting list, and so they may have to wait for an opening in order to return back to their initial program. My choice services could be different than the My HealthLink waiver services. So it could, it might be a lower level of maximum hours or different eligibility for personal care, the personal emergency response. So again, it's really important to consider. There are a small number of My Choice participants that live in an adult foster care home or a home for the aged. People who are in these settings that need a lot of extra care may have Medicaid pay for their AFC care, and then they may also get My Choice to pay for their extra care that they need. So this is for really, really frail people in an AFC setting. So very few people are in this situation. But because this is such a small niche group, this setting may not be approved under the new rules for the My HealthLink waiver. This is a really important issue to discuss with their current My Choice support coordinator on whether or not moving to a My HealthLink plan would be advisable. For PACE participants, so under PACE coordinates all the care. We have to use PACE primary care physicians in the PACE centers and other providers that the PACE works with. So one of the things to consider is this PACE part of the My HealthLink system? It's probably not. Are those individual providers part of the My HealthLink system? Maybe, maybe not. And so because PACE is also, it integrates the care, but they act as an insurer, if somebody is in My HealthLink, they may forego some of their PACE services, or they may have to pay for some of those PACE services. So My HealthLink and PACE, they do not integrate. Also, if somebody has home health, the personal care services in My HealthLink will be provided through the health plans and not through DHS. My HealthLink enrollees can have the same providers that they've had in home health, and the same plan of care will be provided until a new assessment is performed. Another thing to consider is there's some people who have Medicare and Medicaid but also have an employer or union-sponsored health insurance plan. This happens a lot in the nursing homes. So if they join a My HealthLink plan, that may kick them out of their employer or union-sponsored plan, and they may not be able to get that back. So it's really important that people check with their retiree benefits management system before switching plans to see if they would lose it. Also, most people who are eligible for both Medicare and Medicaid who are enrolled in a Medicaid managed care plan and opt out of My HealthLink will receive Medicaid services through Original Medicaid. So it's either Original Medicaid or My HealthLink. There's not an option of a different Medicaid managed care plan in the My HealthLink region. With the exception of only the people with Medicare employer or union-sponsored health plans may continue to receive Medicaid services through a Medicaid managed care plan if they don't participate in My HealthLink. So let's talk about the enrollment process and what happens after. So we've already been through round 1 of enrollment, and so for Wayne and for all the different regions, it happened last year. We had the UP and Southwest Michigan happening the early part of 2015, and then Wayne and Macomb counties happened a little bit later. So that process last year started April 1st, 2015, and went a little bit beyond July 1st of 2015. So we've already kind of survived that. How it worked last year is there was an opt-in enrollment, so people would start getting notices 60 days in advance of any change, saying, you know, hey, we're going to switch your plan in 60 days. This is what we're going to switch you to. And so people could decide to switch earlier if they wanted, or they could decide to enroll in a different MyHealthLink plan. And they could do that. That's called opt-in enrollment. They could, once they were notified that this was going to happen, they could take action and do what they wanted to do. All other people, though, right, they would get their 60-day notices, their 30-day notices. All other people, if they didn't do anything, their services would automatically start. It was like an automatic enrollment or a passive enrollment. So unless somebody chose a different MyHealthLink plan or opted out, people were passively enrolled in a plan. And that's how it worked last year. We're in the midst of round 2 enrollment period, and this is true for all MyHealthLink regions. We're just doing it all at the same time this year. And it works the same way, that there's passive enrollment of individuals unless they opt out. So people got their 60-day letters around April 1st. They'll get their 30-day letters around May 1st. And then if people don't, in this time frame, choose a different MyHealthLink plan or opt out, their services, their passive enrollment into MyHealthLink will begin June 1st. So people for MyHealthLink will receive a letter explaining how to enroll in a MyHealthLink plan. Spoiler alert, that's through Michigan Enrollee. Whom to contact for help? Well, that's us, the Medicare Medicaid Assistance Program. And then how to opt out if they don't want to be part of MyHealthLink. And again, that's through Michigan Enrollee. People can change plans or opt out at any time. If people opt out, the state may not automatically enroll them into a plan. These people are still eligible to enroll if they want to later on, though. So after enrollment, what happens is they're going to get a welcome packet that's going to include a MyHealthLink card, a provider directory, summary of benefits, and a handbook. And then enrollees will have some screening. They'll have an initial screening, which will determine whether or not they might be eligible for long-term care supports and services or behavioral health services. They'll get a level 1 assessment that kind of goes into that in a little bit more detail. Then if needed, enrollees will also receive a level 2 assessment, which will actually kind of assess them and give them specific parameters and a plan of care for their long-term care services or behavioral health services. And then each enrollee will develop his or her own plan of care, and that's that thing I was talking about before, where, you know, if that member, you know, has a few different medical conditions but walks with a walker, and maybe their goal isn't to control their diabetes or to you know, control their heart. You know, maybe they think that's all fine, but they wanted to not walk with a walker anymore. You know, they're driving their own plan of care and setting their own goals. So what do these screenings and assessments look like? Well, that initial screening are just 9 yes or no questions to identify if there's any current services in place or identify any immediate or unmet needs. This is done over the telephone, and people will call to, this is done over the telephone, and they'll just be asked simple questions during that call. So, you know, this usually happens at the time of an enrollment or shortly thereafter. For people choosing not to answer these questions on the phone, the plan will work with that person to complete the questions some other way. The Level 1 assessment is a broad assessment that's used to identify and evaluate current health and functional needs. So this is completed within 45 days of the start of enrollment and serves as the basement for further assessment. So kind of the initial questionnaire is more of like a triage, and then Level 1 actually gets down and says, are you eligible to have a further evaluation? And that further evaluation is Level 2 assessment. So Level 2 assessment is completed within 15 days of the Level 1 assessment. And so that Level 1 assessment is going to go into details. And it's going to, okay, are you eligible for further assessment? Yes. And then this is where the nitty-gritty happens, where they're going to get really into the weeds and talk about the behavioral health needs, intellectual developmental disability needs, long-term care supports and services needs, and the health plans will collaborate with the PIHPs and long-term care supports and services agency to, help with transition and help, work through some of the services. And additional supports and services will be coordinated to meet the needs identified. For people needing nursing home or waiver services, the nursing facility level of care determination will be completed as part of the Level 2 assessment. And then the health plan will coordinate with the long-term support and care supports and services provided to meet the enrollee's needs. Also at the Level 2 assessment for people identified with behavioral health care needs, the plan will make a referral to the PIHP. The PIHP will complete a telephonic screen to determine mental health services need and referral to the provider. So, with the Level 2 assessment for behavioral health, you actually have the PIHP experts doing that. So then, after those assessments are done, if needed, not everybody will go through all that, that's when they have a support plan. And so each enrollee will help develop his own care and support plan with the care coordinator, and will choose the people to participate in the process, and this can include family or friends or providers, and then invited integrated team members. This is a person-centered planning process, and it would be done within 90 days of enrollment. And this is really going to be the single game plan that coordinates all the care for the year for this particular member. It also contains a plan for addressing concerns and goals, as well as measuring ways to achieve them. It identifies specific providers, supports, and services, including the amount, the scope, and duration. And it lists the person responsible and the timelines for specific interventions, monitoring, and assessment. So this is a very timely and measurable, goal-oriented plan. So the supports plan will contain the enrollee's preferences for care, support, and services, a prioritized list of concerns, goals, and objectives, and screening and assessment results. And then the care coordinators will maintain ongoing relationships with the enrollees to assure that the assessments and care plans are revisited and updated periodically, that any questions and concerns are answered and addressed, and that the health issues that they have get the attention that they deserve. And really, the care coordinators want to make sure that the enrollee is satisfied with My Health Link. So that's kind of what that enrollment process looks like, and what kind of, that coordination looks like. So what is our role as MAP? Well, our role as MAP is we're there to help them choose a plan for them, whether that's the 5 My Health Link plans for Macomb County, or, original Medicare Medicaid, and a PDP. So the first thing that we need to do is triage the MyHealthLink caller. Are they eligible for MyHealthLink? You know, some people have received notices in error. For example, we've received quite a few calls from people in Macomb County that received notices from MyHealthLink, and because they don't live in Macomb County, they're not eligible. Are they part of an opt-out group? So are they part of My Choice, PACE, or have employer coverage? That would make, you know, those people potentially want to opt out. The next thing that we do is explain the options. So we talk to them about, you know, they can stay with their current plan and opt out of MyHealthLink, or they can enroll in a MyHealthLink plan, either the one that was automatically chosen for them or any of the other ones that are available to them. And from there, we would actually go to the plan finder, and we would do a prescription drug search, you know, just like we do with any of the other beneficiaries. So we'd go to Medicare.gov and enter in a list of their prescriptions. It's important to note on the plan finder, make sure that it's indicated that they have both Medicare and Medicaid. And then when you get to the screen where you can choose looking at prescription drug plans only or Medicare Advantage plans only, you want to look at the Medicare Advantage plans. For providers, people would want to make sure that their providers are covered by whichever plan may work out for them. So, you know, you may do the Medicare Plan Finder and find a MyHealthLink plan that's going to be great for them. In the Plan Finder, the MyHealthLink plans are noted by, it's listed as the plan type, Medicare-Medicaid. And those will be the MyHealthLink plan. So you may find a MyHealthLink plan on the Plan Finder that looks like would be perfect for them. So the next step is to see if the plan's providers are covered. And, you know, you may have the beneficiary, you know, call their doctors to see if they'll take the MyHealthLink plan, or this information will be on the plan's website. So you can take an extra couple minutes and do that research for them. And then the final step is provide them with the results. You know, we can just tell them which MyHealthLink plans would work out for them, but we cannot enroll them. You know, we cannot enroll them on Medicare.gov. We cannot help them enroll through the plan. All enrollment into MyHealthLink is done through Michigan Enrollee. So, and the beneficiary has to do it. You know, in order for somebody else to talk on their behalf, they would have to fill out a form authorizing that person to do it, but they have to call Michigan Enrollee to get that form to them so they can fill it out. And if they're calling Michigan Enrollee anyhow, you know, they'll probably just want to, you know, do it themselves. And of course, those with, you know, cognition issues, you know, they would have a loved one do it on their behalf. You know, having that form filled out. Yeah, because unfortunately, Michigan Enrollee does not recognize MMAP as somebody who can talk on behalf of somebody. They really are very vigilant about making sure that the proper authorization forms are filled out as far as people talking on somebody else's behalf. So with MyHealthLink, when we do our counseling or client contact reporting, there's a couple extra fields. This is from a screenshot from ShipTalk. ShipTools has the same questions. It just looks a little bit more user-friendly. So there's just 9, you know, very short questions to answer. You know, what is the source of this referral into the duals program? So this is language that is used nationwide, so it's not necessarily our language. So duals program means the MyHealthLink program. So was it referred from the state Medicaid office? So that would be, you know, DHHS. or their caseworker. Was it referred from an enrollment broker, and that's Michigan Enroll, referred from 1-800-MEDICARE, referred from CMS Federal Coordinated Healthcare Office, referred from an appeals process, or self-referred, or other. Was enrollment broker a topic discussed or service provided? Just a yes or no question to see if we've talked about Michigan Enroll. Was a letter received from a state Medicaid office the topic discussed? Well, most people find out about us through those letters. Was managed care options a topic discussed? So if we're talking about any of the MyHealthLink plans or opting out, we're talking about managed care options. So, you know, most of the time we'd be answering yes to this question. Was enrollment assistance a topic discussed or service provided? Any other Medicare issue? Did we give them publications or other materials to read? Did we refer them out to a different organization, and if so, where did we refer it to? So did we do refer them back to the state Medicaid office? That could be their Medicaid caseworker, or you know, the Michigan Department of Community Health, anybody in there. Did we refer them to the enrollment broker, which is Michigan Enroll? Did we refer them to 800-MEDICARE, or refer them to the CMS Federal Coordinated Healthcare Office? Did we refer them to an appeals process, stated the MyHealthLink Ombudsman, or did we not refer them out or refer them to somebody else? And then finally, they want to know the beneficiary disposition. What was the outcome or perceived outcome? Did the beneficiary opt out? Did they enroll in a different MyHealthLink plan? Did they did they actively enroll in a program and managed care plan of their choice? Did they stay enrolled with their passive enrollment plan, or are they still making their decision? So that's it on the reporting. Now, coming soon, there are a couple different things that you may want to participate if you're interested in. The first is there's a Macomb Forum. So the Michigan Department of Health and Human Services is holding a forum on May 5th from 9 until 11. It's going to be at the MORC offices in Clinton Township. And this is actually a forum, it's a public forum, so anybody can attend. The last forums, they've had providers attend, different nonprofits attend, some of caregivers or beneficiaries attended. So if you want, you are welcome to attend this. It's great information. Also, if you're talking with somebody on the phone or, you know, a client, and you want, they seem really interested in this, they are welcome to attend this as well. The second opportunity that's available is a provider webinar. So this is just for providers. So we are considered a provider. So all of the MAP counselors, whether you're a volunteer with another organization, you all are welcome to attend this. It's coming up on April 19th from 10 to 11. And it's on, you know, if you're interested in doing this, here's a link to their flyer. It's actually on the MyHealthLink website, so you can go to michigan.gov/MyHealthLink. I do believe that they might record this webinar for a later viewing, but I'm not 100% sure. They have in the past. Finally, there's a couple resources I wanted to tell you about. The website for MyHealthLink is michigan.gov/MyHealthLink. It's a very, very wonderful website. It's a wealth of information. And I want to show you something on that website now. So here's the MyHealthLink website. You can see there's information on the provider webinar, so if you wanted to attend that, there's a link to register. There's a really great My Health Link resource toolkit. I'm going to click on that real quick. There's a bunch of different guides and letters. So there's some great guides on specific instances. So if you have somebody who's on hospice and want to find out more about how My Health Link works with hospice, there's a fact sheet on it. There's a fact sheet on My Health Link Part D replaces your current Part D plan, long-term care supports, enrollee protections. Also, any of the letters that they send out, there's a copy of these letters here. So that's really, really helpful for us because we can see what those look like. There's some, other resources too, but this is really great, and they update this all the time. I'm going to go back to the main My Health Link page. There's one more thing that I want to show you on this, and this is this Advocates Guide. This Advocates Guide was put together by the Michigan Elder Justice Initiative. They've been working with the My Health Link implementation since the start. And their role in this is to make sure that, the beneficiaries, the people with Medicare and Medicaid are served and served well, and that their needs are being met. So this is 60 pages, but as you can see from the table of contents, it's a wealth of information, and when you click on something, there's links to other things. So this is just really, really well done, and I encourage you, if you are working with My Health Link people, to please access this. The other thing I wanted to show you is the My Health Link Ombudsman website. Again, this is a relatively new website, but as you can see, it's been updated to reflect some new information. And as you can also see, the advocates guides on here. There's some health plan information, which is also available on the other website. The contact information is for the My Health Link Ombudsman is readily available. So it's a great tool for you to know about. And with that concludes our My Health Link training. If you have any questions, please contact your site coordinator or myself. Thank you so much for your participation, and please make sure that your site coordinator knows that you've attended so you can get credit.